Maternal health and child health is a key priority globally and in our countries. And is one of those Millennium Development Goals many developing countries are struggling with. And as health workers, we know a family and a woman having the right timing, having the right spacing, having the right number of children that she or they can be able to adequately support has an impact on the health of the child and the woman and the family. Then we have people who have other health challenges which make them even a lot more vulnerable to complications related to pregnancy and childbirth. So we understand that each individual may have what is optimal in terms of what they can have and so on. Then depending on what method of delivery and what complications have been experienced when one is delivering, we know that subsequent deliveries have to be properly timed, properly managed, and well assisted by a well-equipped health facility and health workers to ensure safety of both the mother and the outcome, good outcome of the pregnancy. First and foremost, I think to clarify, sometimes we've had misconceptions about religious and faith-based institutions and leaderships, positions and perceptions about family planning. I think we like to make it very clear about our perspective of what family planning is. It's about empowering women and families and their husbands and their spouses and their families to make their choice, the most appropriate choice in terms of timing of the pregnancy, about spacing that is healthy, about the number that is both healthy for the woman and for the child, but also that as a family they're able to adequately support, through the developmental stages of a child up to the time they're educated and so on. So with that common understanding, ideally, would appeal to the church, both within our countries and outside, that we have a shared understanding about what family planning is about, and then appreciate why it's important, because it's considered one of the best strategies in improving maternal health and child health, particularly neonatal newborn health. That by assuring the health of the woman, by assuring the health, we're able to improve the health and ensure healthy delivery, healthy child that is born, and then a family that is able to adequately cater and support for their children. An unintended pregnancy means that they were not prepared for it. So a couple of things for the unborn child. Either the health of the mother is not good enough, both physical or mental, psychological, or nutrition-wise, and therefore you can end up with a child developing complications or being born with complications. Secondly, it could be that the mother's state of health is such that she deteriorates within the course of that pregnancy, and it could have harmful effects, either further complications or even sometimes lead to mortality or death of the mother. The other implication is that a mother carries a pregnancy psychologically. She's so traumatized because she's not ready and prepared for it, and therefore that affects her mental health. But while the child, as regards the child itself, you have a child or children born when they're not expected, or maybe the family was not ready, and they come to an environment where there isn't enough or adequate care or support extended. So the child grows with difficulties. Either they are too many close together, they need food which they can't get adequate, they need health care, they need schooling, they need things that the family is not able to provide. So that also affects the growth of the child and subsequently the opportunities that that child could otherwise have had if they got good upbringing, good education for their future. Support us to be able to expand and the scale of what we are doing in family planning services. Help us to have a more integrated approach to reproductive health. Help us to address some of the barriers, some of the gaps, to enable us deliver a better quality service. Then the other appeal I would make is, we engage in consultation to build consensus on our messaging around family planning. I think one of the gaps that we have is how we can engage the religious infrastructure, the religious structures. We have churches, we have national structures, regional structures, parish level, congregations, communities, women's groups, youth groups, men's groups. Then we have the clergy, and we have the lay leaders. It's a rich opportunity in terms of messaging and empowering behavior change. So we need an approach that we have health workers as resource people work with the religious leaders and the leaders within faith communities to be able to come up with consistent messaging that is appropriate and that addresses the best interest of the woman, of the child, of the family, and avoid getting involved in a lot of or stuck in controversies and different messaging around why and what in family planning.